Research.
All right. Okay, so let me just get over here. My name is Matt Fuser. For those of you who don't know me, I joined the practice about a year and a half ago. Last September, I attended a veterinary conference, and we learned about stem cells and learned about a lot of different pain management options. And then shortly thereafter, both Dr. Burcham and I were credentialed in stem cell therapy, and so that's one thing we'll talk about today too. But we want to make sure that everybody knows of the options, and so that's why we put this together. Go ahead and start with today's agenda. We're going to go ahead and talk a little bit about arthritis, just kind of what it is and why it causes pain. Our talk today is about non-NSAID options. NSAIDs are non-steroidal anti-inflammatory drugs, and many of you may know or recognize some of the names when we get that. We'll say a brief word about that. We'll talk about the importance of weight loss and exercise, nutrition, and then we'll talk about some of our products, including Adequan, some pain medications we can use besides NSAIDs. We'll talk about some joint supplements and a few alternative therapy options as well. I tend to get a little long-winded, so we'll probably have a little bit of a break after that, and then Dr. Burcham is going to talk about stem cells. So first off, what is osteoarthritis, or just arthritis for short? Basically, number one, it's the number one chronic cause of pain in pets, and it can occur in young pets, but more commonly we see it in our pets as they get older. Basically what happens is in between the joints there's sheets of connective tissue called cartilage, and over time that cartilage wears down, and as there become breaks and wears in the cartilage, the bone is exposed. The cartilage itself doesn't have any nerve endings in it, so it doesn't feel pain, which is why it's such a good cushioning force there. But once the bone's exposed, then the nerve endings are exposed. That results in pain, results in inflammation, and then as damage occurs, that just gets worse, and so it is an ongoing process. To some extent it is irreversible, but we do have a couple options that can help to change some of the things that occur, and we'll talk about that as we go on. This slide just lists a lot of the signs of arthritis, and since you're here, I assume most of you are aware of a lot of these. So I think this slide is a little bit preaching to the choir, but I will say the signs start very subtly, and most of the time the first thing we'll notice is that our pets are just a little slow to get up, they're a little stiff, maybe in the mornings when they first wake up, and those are just some subtle signs of arthritis. But it can also be, our pets can be very painful, they can be limping, they can have trouble getting around, they can become aggressive because of the pain or have changes in their personality. I want to point out